environment, we will not only be responding to infection, but we will also be preventing infection. So, if you also observe physically, you observe that the infection, the level of people who are infected increases in certain seasons. Certain seasons, it will also come down. More especially in the dry season. It dries up. Of health, the freedom of housing, every represented here, sorry, through the protocol, the National Regulatory Agency have considered to flag on this program in line with the One Health strategy that will help to strengthen the health system in the states. So the program basically is to look at how we can prevent Lassa fever through basic environmental sanitation and the control of rodents. So at the end of this program has been lined up to run for a period, flagging up with the training from today to Saturday. Today is basically the training. Tomorrow we're going to the field work into the communities to see how the problem can be addressed. And on Saturday we're having a novelty football match, which is to raise awareness why people need to take actions to address this problem. As we know, the local government chairmen that are here cannot help you to come to your house and sweep your house in the morning. There is something they can do. The head officers also have a role to play, but they cannot also come to your house and make sure that they keep your house clean. So meaning that the people need to have a sense of ownership of the process. If we can keep our environment clean, if we can make sure that the women, make sure that their kitchens are clean, make sure that their wastes are properly bagged, if the elders in the community can make sure that they institute weekly and community sanitation all the time, no government will have less work to do. The health officers will have less work to do. And the World Health Mission will also have less work to do. So this is the reason why we're here, to foster this partnership for sustainable solutions that can address the problem of Lassa fever in these two local government councils. So there is a strong need for us to know that this is not a problem. It is not a problem, or it's not a program of the WHO or the Federal Ministry of Environment, but a program of the people to provide solutions to the problem of the people, by the people, using the people, for the people. And that is the essence of why we're here. So it's important that all of us know that we all have a role to play. We all fit in the question of solving this problem. And that is why we said, within the level of the WHO, let's start something. Then the community, the local government council and the community can take ownership. And I want to believe, since the chairman is here, and the people are here, and the health system is here, all the stakeholders are here, meaning that we are very confident that at the end of this section, there will be ownership of this process, and we can all carry this process together. Before I wrap up this section, I want to quickly make some few passionate appeal. Right. From the head of the NCDC, the Nigerian Center for the, we don't have all the resources it takes to provide all the things that are needed. But we feel that change begins somewhere. And how do we start this change? So we want to make sure, passionately appeal that the council should make sure that this program and this program we're trying to, that we started today, is sustained. Especially the aspect of the practical, because tomorrow as part of the program, we will be in the communities to carry out rodent control and also have some materials. I think there are some baskets that have been provided by the WHO and partners to help to make sure that there is effective rodent control, effective waste control, waste management in the communities. These are properties, are no longer properties of the WHO or Federal Ministry of Environment, that are property of the local government council. We want to ensure that they should try as much as possible to sustain this program, to sustain these activities of making sure that every day in the week there is routine sanitation in the communities, and that rodent control activities goes on. As part of the engagement, we people say that from the environmental officers, there are some challenges in terms of logistics to carry out activities, in terms of basic welfare support. We want to also use this final appeal that the chairman should look into these areas to make sure that adequate logistics are provided. So that within this period, let's give ourselves 1 month of intensive activities in the communities, intensive rodent control activities in the communities that Lassa fever will be bring to evolve. And also the community volunteers will be trained. They needed support to make sure that it's sustained. We are so excited with the number of people, the number of community members who come out today to make sure they are part of the training, which is good for the community. But because the resources that have been provided is just for a very few persons, we could not accommodate them. But however, we've appealed to them that the leadership of the council, the leadership of the people, may look forward that in the nearest future, there may be need to sustain them. But for now, let's start with what we have. Distinguished ladies and gentlemen, we want to believe that the change the world needs begins with all of us. And it begins now. And therefore, all of us have to take this program serious and have that sense of ownership. And believing that we are the instruments that will bring about the needed solution to Lassa fever in Edo State. Thank you so much.